Hey, 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 welcome to Lamp and Light Fellowship of Nurses, where I am your host, Nurse Fran. And the goal over here is to equip nurses and change lives. And the way that I do that is by offering tutoring sessions, one on one tutoring sessions to nursing students in the courses of med-surg, pharmacology, and fundamentals. So if you are having difficulty understanding some of the concepts of those subjects, please feel free to go to the website www.lampandlightnurses.com/services and book a one-on-one tutoring session. And another way that I do it is just by, doing some of these videos on YouTube, right? So what we'll be talking about today is falls, and it's going to be a very brief topic. But falls is one of the leading cause of death, of injury, fatal injury in the elderly population. And when I say elderly, I'm referring to individuals who are 65 and older. And it's also one of the leading causes of hospital admissions, trauma-related admissions, and it's because of falls. So falls is not anything to be taken lightly. So as a nurse, we want to be proactive to ensure that our patient does not fall. So whether we are in the community setting or whether we are in the home setting, right? In the community setting, home setting, or in the hospital setting, we want to make sure that we are proactive in educating our patients on fall risk and using our education and putting interventions in place, y'all, that's going to help prevent falls in this population. So, one of the ways that we're going to be proactive and one of the ways that we're going to help prevent falls is by assessing our patient. And the reason why we're going to assess our patients is because we're going to be reviewing our patient's medication. Anytime we assess, anytime we gather information on a patient or question a patient, ask them questions, things of that nature, that is considered an assessment. The assessment drives our diagnosis, nursing diagnosis, which in turn drives our planning, which helps us to determine which interventions that we are going to put into place, y'all. So, one of the ways that we're going to be proactive and help prevent falls is going to be by reviewing the patient's medications. And we got to realize that if patients are on certain medications, that increases their risk for a fall. And the list that I got for y'all that I gathered is from the CDC, or the Centers for Disease Control. And there are 10 medications or medication classes that are listed. There are anticonvulsants, antidepressants, antipsychotics, anticholinergics, antihistamines, benzos, opioids, sedative hypnotics, medications that can lower blood pressure, and also muscle relaxers. So we have patients on any of these types of medications. We got to realize that that puts that patient at an increased risk for having a fall. Your homework is to go and research medications that are in each one of those classes, right? Because when it's time for you to act as the nurse, you want to make sure that you're doing what you're supposed to do to help keep your patient safe. And one of the ways that you keep your patient safe is through educating yourself, right? So you just want to educate yourself on what's up. So just because your patient is on that medication, that does not mean that they're going to fall, but definitely these medications will increase their risk for a fall. And also in the elderly population, you got to keep in mind that they have other risk factors, that make it more likely for them to fall. And some of these risk factors include impaired mobility. They might walk with a gait. They might walk with a cane, or they may have a limp. They may be in a lot of pain, so they walk with a limp, right? They may have impaired vision. They may wear glasses, and some patients, they have glasses for years and their vision will be bad, right? And they don't want to go get their eyes checked sometimes. They may have cataracts. So again, they may have glaucoma. They may have things that's going on with their vision. So keep that in mind. And also in the elderly population, they have problems with hearing. So that also increases their risk for falls and injury. Also, the elderly population tends to be on a lot of medications at one time, what we call in the medical community polypharmacy, right? So that also increases their risk for fall. Impaired elimination You may have some elderly, they have urinary incontinence. And just think, if you got to rush to the bathroom and you're running to get through the bathroom and you're going home, and what happened if you can't get to the bathroom in time or something is in the floor and you trip and you fall? So you got to look at the other risk factors that they have that increases their risk for a fall, coupled with these medications, right? So when you think that, your antenna should go off. Look, my patient is at an increased risk for fall. So what can I do? What are the interventions that I can put into place to ensure that my patient is safe and that they do not fall? So this is just something that I want y'all to think about. And again, your homework is to go and you're to find out which medications are in each class. Familiarize yourself with anticonvulsants, with antihistamines, anticholinergics, muscle relaxers, medications that can affect their blood pressure. And medications that can affect blood pressure is not just blood pressure medications, right? You have other things that can affect, other meds that can affect a patient's blood pressure that are not listed as or classified as blood pressure medications. And also, so again, just go familiarize yourself with that so you can be on the up and up. You can be on the no, because you want to be proactive, y'all. That's the big thing. You want to be proactive. You want to be safe. And I hope that this teaching, the mini teaching, has helped y'all, has been beneficial to you. And if it has, please feel free to share it with some of your nursing friends or some of your nursing school classmates, right? So feel free to share it. And if you have not joined or subscribed to the channel, please make sure that you subscribe to the channel and also follow on social media at Lamp and Light Fellowship of Nurses. It's the same on Instagram. And on TikTok, it's Lamp and Light Nurses. And again, I hope that this message has helped y'all, or the word has helped y'all, and y'all have a blessed week. Bye.